What about anesthetic drugs? Are there anesthetic drugs that can be implicated in causing problems or actually increasing mortality? Well, again, that was why this study has been so helpful to me. What they were able to show without a doubt was that premedication reduces mortality. So that grabbing your dog and either masking it down with no pre-meds or placing an IV and inducing it with an induction agent is not the best thing to do. So pre-medication reduces mortality. I get a lot of pushback from people that say, well, the dog is too old or too young, or cat, or too sick to have a pre-med. And I'm like, The drugs that kill animals are the induction drugs and the inhalants. Those are the most cardiovascular depressant drugs that we deal with in anesthesia. So if you give lots of nice pre-meds that are anesthetic sparing, so you can decrease induction and maintenance drugs, you're going to make a big difference in your mortality rate. So Acepromazine reduced the risk factor by up to 5-fold in one of the large clinics that they looked at, specifically data in that one clinic. Acepromazine, it's pretty inexpensive. It's not a controlled substance. What does it do? Why is it so good? And this is true even in horses. If you give a horse Acepromazine before you anesthetize it, it is less likely to die. So it decreases the dose of induction drugs, and it can decrease the need for inhalants by up to 40%. And that's the drug, those are the drugs that get us into trouble. The other things about Acepromazine is antiarrhythmic, it's antiemetic, but it's also calming, so you don't have these rough, crazy recoveries. So lots of good things to say about Acepromazine. The alpha-2s, it was very good because they were able to go back and look at the data where the only alpha-2 we had was xylazine. And they looked at the previous UK data, which was this Clark and Hall data, and then they looked at, this is data from the United States, this is data from Canada, and this is data from the United States. There is absolutely clear-cut evidence out there that the use of xylazine increases the risk of mortality. So xylazine as an alpha-2 does, and actually in the Canadian study, it was actually a huge factor in causing cardiac arrest. And why does that happen? Because xylazine sensitizes the heart to catecholamines. And so if the dog gets excited in recovery or is painful or is being masked down and gets excited, you're going to be in trouble. The good news is the latest data on medetomidine and now dexmedetomidine does not show any increased risk. So these are drugs that can be used very effectively. They showed that it decreased risk of death similarly to Acepromazine. And the reason for that is quite scientific. We do know from research studies that these two drugs do not sensitize the heart to catecholamines. And I also think that now people are much better educated on the use of alpha-2s. The drug companies have done a very good job of explaining to people, what does an alpha-2 do? It makes the heart rate really slow. It does this, it does that. And I think we're much better at using alpha-2s. So xylazine, I can't support the use of xylazine, but medetomidine and dexmedetomidine, yes. The induction technique does matter. And certainly, again, the dog is too old, too sick to have anything except be masked down. No, that is not true. If you mask down an animal, it's more likely, certainly the dog data, it didn't actually come out as being significant in the cats, but in dogs, it increases the risk of death 6-fold. So masking down is not a good idea. And what they specifically mean is that grab the animal and just mask it down. Now, I will mask down cats and dogs occasionally, but they've usually been sedated and not with something like xylazine, but they have been sedated. They're usually fairly calm, and sometimes I do mask them down because we can't get an IV in or we can't whatever. But the straight take your dog or cat and mask it down is something that we cannot really support based on good evidence-based medicine. So the mask induction, there's no doubt it's stressful. You're going to get catecholamine release. You have an unprotected airway, so certainly in those brachycephalics, it's not a good idea. But the main reason is if you're masking down an animal, you're giving them a massive dose of anesthetic, of inhalant agent, and you're going to have a lot more cardiovascular and respiratory depression from that technique. When it came to inhalant agents, they were able to show, compared to the previous study, that halothane, which we almost don't use at all now, halothane did increase the risk of death, so now we're not using it. Mortality should be better, but there wasn't enough data There weren't enough people using sevoflurane. So we don't actually know at the moment if there's any difference between isoflurane and sevoflurane. Intuitively, and based on some much smaller studies, we would probably say that there's unlikely to be a difference between those two agents because neither of them sensitize the heart to catecholamines the way that halothane used to. Does it matter who monitors the patient? And the answer to that is yes, it does. If you have a dedicated person, whether it be a technician, a volunteer, a student, or a qualified anesthesiologist, if you have someone paying attention to just the anesthesia, then it does decrease mortality. And I think that, the phrase, there are no safe anesthetics, no safe anesthetic procedures, just a safe anesthetist is very true. But I also understand that's not always possible in a large volume spay and neuter situation. So we'll talk about how we might get around that. Human error does contribute to anesthetic death. Anybody, I've probably given it away by these pictures. What do you think the commonest human error is? The pop-off valve. And that came out in this study. They had the commonest human error that results in an animal dying is getting the bag blowing up, the pressure going way up. Someone turned the pop-off valve closed and then forgot to open it. So I would definitely suggest that you invest in, we have these safety valves on all of ours because, I'm trying to keep track of lots of students that are new to anesthesia. So we almost never use this except at the start. We're testing out our circuit. When we want to give the animal a breath, we just push down with that, squeeze, let go. There's no way of turning off or turning close the pop-off valve. But it's a common cause of death. You've probably all seen that where you run across the room and disconnect and hope that they made it. Yeah. What we were able to find out from this study is that monitoring the pulse or using pulse oximetry decreases mortality, certainly in cats. They had very good data. So if you are doing something about, monitoring the pulse or using a pulse oximeter in a cat, you decrease the odds down to 0.2%, a huge decrease in mortality, probably because it alerted you to something was about to happen or something was going wrong. So if you're monitoring the pulse and using pulse oximeters, it's going to alert you to problems. And certainly it is a good idea. We'll talk about what I think is practical monitoring. Quality of recovery, they showed that poor quality of recovery increased mortality. So is that due to pain? Probably. If you have an animal that's, having a violent recovery and painful, we're going to have catecholamine, all sorts of reasons. So focusing on a nice, quiet, comfortable recovery is going to decrease your mortality. And we've seen this dog. This is not good. Yeah. So that kind of recovery actually can result in death and a lot of problems. So we need to focus on not having that happen. Hopefully we went through a lot of that in the last session. So temperature. It was only in that study, the 80,000 cats and 90-some 8,000 dogs, temperature was only routinely monitored. Now, obviously, everyone had a TPR before they went in for their procedure, but it was routinely monitored in less than 3% of cases. And I think that temperature and maintaining normal body temperature is something that we really could improve on and we should be focusing on. So we're going to talk about that a little bit later. Number one on my top 10 list of anesthetic problems that we can do something about is hypothermia. If he was doing my top 10 list, I don't know what would be 10, 9, 8, 7, but number one for sure would be hypothermia. So are we doing better than we were before? Well, the answer is yes, we are. Certainly we've had a decrease in overall mortality. It's pretty nice. Decrease in dogs. Healthy dog mortality has decreased a lot, as has sick dog. We're better at dealing with sick animals. And then for the cat, the improvements are still there, maybe not as good as in the dog. And we still have this issue of healthy cats being more likely to die than healthy dogs. But maybe we're beginning to understand why that is from what I've been saying. So summary of the risk factors in both dogs and cats: health status, obviously, weight, extremes of weight, age, older animals are at higher risk, duration of the procedure, and then the specific things in the cat: intubation and IV fluids, and in the dog, the mask induction was found to be caused increased risk of dying. Other things to focus on, most deaths occur in the first 3 hours after anesthesia. So if you're going to change how your clinic runs, you should probably be dedicating people to look and monitor and be watching the animals during that critical time. So we now have, actual recovery units that are fully staffed during that critical time. And it's obviously, if that's when the problems arise, we should be focusing on trying to look at that first 3 hours. So we should, and it kind of makes sense, you're doing a procedure, the animal's on 100% oxygen, it's on the table, it's being kept warm. You take it to the recovery room, you pull everything off and walk away. And so you're pulling off a lot of support at a very critical time. We know that cats get airway obstructions. And if you remember that data, at some point, 20% of animals, we didn't know why they died. And if you go back and look at that data, basically they went back to the recovery room and found the dog or the cat dead. And certainly that's something we should avoid.